Good morning.
Good morning. How are you?
I'm doing great. What about you?
I'm good.
All right, amazing. I'm glad you are here. So let's get started real quick.
So,
Okay. All right. Tell me a bit about your NCLEX journey.
oh, well, I got done and I just took the N class one.
Okay.
Yeah, I just when I got done with school, so I decided to just go and take it like they say. So I took it, but I didn't pass.
Okay.
Yeah, and since then, I just decided I'm not going to try now, except I get my content.
Yeah.
So yeah, so that's what I'm trying to do. But it just been a lot going on lately, so I haven't really sat down to pay a lot of attention or anything like that.
All right. Yeah, I definitely understand, right? I've been doing this for the past 2 years, coaching students on how to pass NCLEX exam
Mm-hmm.
successfully, right? And definitely I can do that with you, helping you to pass the NCLEX exam. Now, I went through your test report, right? And your test report, you had above the passing standard in management of care, but all other area you had near the passing standard, and I guess one below the passing standard, if I remember. Now, but one thing I wanted to ask is this: did you only focus on management of care when you were um studying? What were you using to study when you were studying for the NCLEX exam, your first attempt?
Anything.
Everything.
I didn't use anything. So in
O-
our school, what has happened when I was in school, they gave us ATR. So
Okay.
most of the time we use the ATR to do practice question throughout the whole program. So as
Okay.
soon as the school will say, go and do your NCLEX within 45 days or so. So
Oh,
that what I just did, like I didn't buy anything. Like now, most of my friends are saying, "Asha, you." I just didn't buy anything. I just went like once I'm done with the school knowledge, I'm just going to try. So that's what happened.
all
Now
right.
I'm realizing maybe I should have done a little more study compared to what we did in school, and
Mm-hmm.
it wasn't as much helpful. I don't think.
Okay. All right. Now, let me tell you something, right? Not only I coach no NCLEX student, right? I coach nursing students. And what I've seen so far so good is that it happened to me as well too, so I can tell you from experience. Now, what I've seen so far so good is that when we are trying to study in nursing school, we don't figure a particular point out before we proceed to the next point. So that
Mm-hmm.
way, we are not creating the right foundation for nursing. A lot of students cannot connect why they are a nurse. They only know the only thinking is, why should I give a certain medication? Why should I recommend a client for a certain treatment? That is the only thing they are trying to figure out. They don't want to know why in the first place are you going to give the medication? And why in the first place would that patient need that particular treatment? Now,
Mm-hmm.
everything in nursing have a foundation. The moment you
Yeah.
miss that foundational knowledge, it become a problem on the NCLEX exam. You are not going to be able to what? Critical you are not going to be able to critically think as a nurse. Now, imagine
Mm-hmm.
this for a moment. Let us say a particular patient walk up to you now, and then they tell you they have confusion,
Mm-hmm.
right? They tell you they have confusion. What body system would you feel is affected? If I tell you right
Uh,
now I have confusion, what body system would you feel is as affected?
confusion. Maybe.
All
Yeah.
right. Now, if it is taking you l- like more than a
Um,
second to think about it, then that is a problem, right? Foundational knowledge. Because all these things I'm telling you right now should not take you like 1 second. You need to lock it down. and tell me the body system. It means that you have been studying everything you need to study, but you have not been focusing on the foundational aspect. That is the reason why when questions show up on the NCLEX exam, you are going to be lost because you don't understand how to critically think about it. A lot of students want to critically think. They try as much as possible to critically think, but nobody is telling them how to critically think. That is the problem. That is why I teach a lot of students how to critically think. In order to critically think about it this way. Take, for instance, you have a laptop, right?
Mm-hmm.
That got what? Bad, damage. And you want to fix this laptop. Now you go to a laptop repairer. The first thing you would tell the laptop repairer is, oh, sorry, you greet the laptop repairer, say, good morning, I'm here to fix my laptop. The first thing they are going to ask you is, what is wrong with the laptop, right? Now you will start explaining, I don't really know. I tried to put it on, it was displaying something on the screen. All of a sudden, it stopped what? Working. Now, what will the laptop repair start thinking at that point? The laptop repair will now start thinking about what you said. You try to put it on, this and that. The laptop repair might even be asking you some certain question. When you put it on, what did it show? Uh, what happened before it went off? Did you turn it off when it started displaying that particular thing, and you tried to on it, or it went off on its own? Like, what the laptop repair is trying to do is to figure out what the likely problem they think is going on. Now, let me tell you one thing right now. There are two aspects to nursing care. Just know everything we do in nursing is because of the client. Now,
Mm-hmm.
the client need internal care and the
Mm-hmm.
client need external care. This is what I make up for myself. I don't know if it exists, but what I would say next exists. Now, the internal care have to do with what? The physical state of the client. The
Yep.
external care have to do with the ethical aspect of the client. Now, this ethical aspect of the client is for you, the nurse, to protect yourself. The physical aspect of the client is for you to protect the client. Right. You are trying to protect your license by doing everything in a ethical way. Physical state, you are
Yep.
trying to what? Make sure that the patient is what? Stable. Right. Ethical aspects have low chance of killing the client, but physical aspects have high chance of what? Killing the client. Right.
Mm-hmm.
So ethical aspects don't involve treatment, they don't involve medication, they don't involve crazy procedure. It's all about confidentiality, privacy, right? Your patient need, patient rights, advocating, and all that kind of stuff. But internal care have to do with medication, have to do with treatment, have to do with procedure, have to do with investigation. This is internal aspect. So NCLEX is very big on this, right? If this is 70% of the exam, this is 30% of the exam. Now, the moment you see your question on the NCLEX exam, you should be able to ask yourself one question as a nurse. You need to like put yourself in your NCLEX question and always ask yourself, what am I doing in this question? Am I trying to treat the patient internally, or I'm trying to like care for the patient external aspect? And if it is internal aspect, what am I driving at? You can see as I'm
Mm-hmm.
walking you through critical thinking now. If it is external aspect, what am I driving at? Because now you cannot just see a particular question and start reading from surface to figure it out. No, you need to understand, one, what am I dealing with? Am I dealing with the internal aspect of a client, or am I dealing with the external aspect of a client? Is this situation related to a particular settings, or it is not related to a particular settings? Because the way we care due to different settings is different. The way you care in maternity is different from the way
Mm-hmm.
you care in med-surg, or in PIT, or in ICU, or in ED, emergency department. We have different form of care. So you need to understand what kind of care do we handle what in maternity, med-surg, PIT, ICU, emergency department. That is how you start thinking. Right. Now, but regardless of everything right here, everything we are trying to do here is to what? If it's involving what? Internal care, we are trying to protect what? The client. So what make up the client? Body system. That's what make up the client. Now, a lot of students don't even know all the body system. Now, let me ask you, how many body systems do we have?
102. I don't know.
Hmm?
I don't know.
All right. You see the problem right now. Okay. Now we have 10 body system, right? It might be more than that for some certain people, but I know why it will be more than that. Most students might separate the muscle from the skeleton, right? But together, I put them together, musculoskeletal, right?
Yeah.
I put them
Oh,
together. Right, so making it 10 body system. Right. Some people also know body system in some certain ways, which if you at least if you know something, but it still makes sense. But 10, right. Now, knowing this 10 body system, that is how you can figure out if a patient the kind of problem a patient is having. Most students will say this. Most students will say, I don't know what a particular disease condition is testing me on the exam. I don't know. I've not seen that disease condition before. I'm telling you, you just take for instance, your laptop got damaged, right? And you carried your laptop, or let me just say your maybe if you are using an iPhone, right? And then your iPhone have a little problem and you take it for repair, and then the iPhone maybe repairer is telling you, oh, I don't know what is wrong with the phone. Would that
mm-hmm.
make sense to you? Because obviously you are trained in this area, so you need to even know what is wrong with the phone. So
Yes.
now, if you go on the NCLEX exam and then you are not saying you've not heard about this disease condition, it's not about hearing about a disease condition. It's about knowing what
Yeah.
to suspect. As a nurse, we start with what? Our instincts. We start suspecting. Even if you don't know the condition, at least you need to know what body system is affected. Because every disease condition in this life, I don't know if we have thousands of disease condition. We have hundreds. I don't know. But what I know for sure is every disease condition come to affect a particular body system.
For
You
sure.
can name many disease condition right now. I will start telling you the body system that is affected. Name one body system. But name one disease condition. Just name one disease condition.
TV.
TB.
Yeah.
Right. That is your respiratory or pulmonary system. Name another one. Make it difficult. Make it
COPD. Well,
difficult. Eh?
COPD. No, I'm
CPD.
saying
That is easy.
COPD. Asthma. All those are respiratory. Yeah.
Yes, they are respiratory or pulmonary. Make it difficult. Make it
Am I?
difficult. Hmm?
Am I?
Emma is cardiovascular.
Yeah.
Mention like 10. Let me answer all for you.
Uh, oh, my brain is. uh, I'm thinking though. I'm coming.
So you cannot even mention 10 bodies 10 disease condition.
I mean, I'm thinking. Okay, so it's.
Ah, no, no,
Uh,
no, 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 no. I'm not happy.
I know I'm not happy either.
I'm not happy. I'm not happy. Because I'm expecting at least like now we have more than 200 disease condition. At least you should be able to mention 10. Nah, we have 10 bodies. And if it's even to mention one for each, you've never mentioned any. Okay, now, okay, I even know where the problem is. You barely know the body system, so you might not even be able to pick according to the body system. At least you're supposed to be able to mention, like, maybe from neuro, maybe you mention Alzheimer's. Am I making sense? Schizophrenia, right? That is
Yeah.
two. Dementia,
Oh my
right?
God.
Depression,
See,
bipolar. Those are
those
problems. Hmm?
not.
Now you go to cardiovascular, you mention hypertension, right?
Yeah.
MI, right?
Yeah. Mm-hmm.
Heart failure, a lot,
Yep.
right? Coronary artery disease, there are a lot. PAD, PVD,
Yeah.
there are a lot. Now you move as well to your respiratory, asthma, COPD, pneumonia, influenza, TB, a lot, right? Then you go to the GI and you start mentioning
Yeah.
a lot. Appendicitis, gastritis, pancreatitis, right? Crohn disease, a lot that you have. Renal system as well too. Acute kidney injury, chronic kidney injury, right?
Yeah.
A lot. Like that, you
Look
keep listing. So now these are things you need to know before you attempt the NCLEX exam. It shows that you are ready. If you don't know what this is, an NCLEX give you something, then how are you thinking about it?
I am not ready. I am not ready. Those people put us under pressure. Then we
Hmm,
were done with school. And they said, you guys have to go and test within 45 days. You guys
hmm,
have to go and test within 45 days. And ever since, like, right after school, right after I tested, my
mm-hmm,
house burned, my mom got sick. So since then, like, I haven't even picked up anything NCLEX related.
mm. Wow.
It's,
All
it's,
right. I definitely understand, right? It
so I'm
it
ready
actually
to
it actually showed because the only, like I said, the only place you had above the passing standard is your management
course
of care.
management of care.
Management
Yeah.
of care. So since you had above the passing standard in your management of care, I looked at your physiological adaptation, which I am trying to test you on right now. You had below the passing standard. So yes, I definitely expect one, you don't know the body system and all that kind of things that I'm really asking you because below the passing standard, right? So now this is it. Now, you everything in nursing is all starts from suspect. And how do we
Mm-hmm.
suspect? We suspect related to what we are thinking, right? And how do you suspect something? You need to know the body system so that you can suspect, right? Now, a patient is having restlessness. All of a sudden, I'm thinking, this patient is having neurological issue. Now, restlessness is a sign and symptom related to neurological problem. But behind the scene, as a nurse, you need to understand why a patient can be restless so that you can start linking it to the information on that question. A patient can be restless because of maybe they have problem with a particular maybe situation, they are worried, they are concerned, or something like that. A patient can be restless due to medication. A patient can be restless due to what? Low oxygen. These are three ways a patient can be restless. Right. So a patient can also be restless due to some certain condition as well too. Right. Such as maybe mental ill patient, they can all of a sudden feel restless. Right. So let me just say four things. Now, so since I understand this thing, right, according to nursing, nursing wants you to pay attention to anytime you have a particular symptom that can be caused by various things. No, nursing encourage you to pay attention to the most critical aspect of it. Like now, everything I've listed are important when the patient is restless. But my first thinking would be like, is this patient having low oxygen? Because
Mm-hmm.
that is one thing that can cause a patient to be restless. There are other things as well as I listed, but the most important thing I would think of first is which of all these things can put this patient in a life-threatening situation. And everything out of everything, right? We have low oxygen. So I'm going to pay attention to what? Low oxygen first. So I will look at my question and I'll find out if it's related to low oxygen. If it's not related to low oxygen, I will not start thinking, okay, I will look at the question again. I'll ask myself, okay, restlessness can be caused to maybe some certain what? Um condition. Let me see if it's related to a specific condition. If it's related, great. I have been able to match my thinking. This is how you critically think as a nurse. All this thinking that I'm thinking right now all come from a foundational knowledge. So if you build up that foundational knowledge, when NCLEX is asking you question, it will make sense. You see a lot of students, they will only read question just to know the rationale to the wrong or correct answer without even knowing the foundation of those answers. Now, when they see another question written in that same format, they are not going to be able to answer it correctly. Why? Because rationale is not just enough to create basic knowledge.
Mm-hmm.
Most questions on the NCLEX exam related to pharmacology. When I see students having below the passing standard in pharmacology, I definitely know that there's a big problem. If you have near the passing standard, not that good, but still makes sense. But if you have below the passing standard, is a problem because NCLEX tests you on basic knowledge related to pharmacology, basic principle. Right. All you just need to know about pharmacology is what are those things that can be life threatening when it comes to what? Medication administration. And pay attention to those knowledge. related, and this is how you find out, because everything in nursing is related to the 10 body system. Now, this is how I'm going to do it, right? If I'm to take the NCLEX exam again, this is how I'm going to do it. I'll now start finding out what kind of medication that can be a problem to the neurological system. What kind of medication can be a problem to cardiovascular? I will do it towards all the 10 body system. So, and what kind of medication can be a problem to neurological system? And what are the complications I need to take note of, or adverse effect I need to take note of, right? So now I will have a list of all these adverse effects. So when I go on the NCLEX exam and I am seeing a particular medication, even if I don't know the medication, I can easily see the answers that NCLEX is testing me on and critically think through those answers back to my foundational knowledge. And then I'm seeing a particular question testing me on reports to the doctor if you notice bruising. A particular answer is saying that. Then I will now ask myself, is this medication related to a medication that can cause bleeding? Then I'm thinking, I'm saying, I don't know this medication, right? But I have done my foundational reading that anytime we are trying to report to the doctor about bruising, we are suspecting medication that can cause what? Bleeding. What are those medications that can cause bleeding? Tell me, what are those medications that can cause bleeding? Let me see.
Mm,
Are we still thinking
Ibuprofen.
about it?
Ibuprofen. I don't know.
There are common medications that can cause bleeding. One of the content on the NCLEX exam is related to the blood. Now, common medication, antiplatelet and anticoagulant. Is that
Yeah.
strange to you?
No, it's not.
So
I just
why
need
why
to
why did you remember it?
I just need to review, like refresh,
No, 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 no.
like
I don't
all
feel
that
I don't feel like you need to review these things. There are some certain things that need to be part of you as a nurse. Right.
uh-huh.
I struggled in nursing school semester 1, 2, 3. I picked up semester 4, 5. Everything I knew in semester 4, 5, even when I struggled in semester 1, 2, 3, I know it till now. I've not had to study anything again. It's part of me. There's some certain things that need to be part of you as a nurse till now. There are some certain things you don't need to review. I don't need to start reviewing where the vital organs are. If you tell me where appendix is right now, I will tell you. If you tell me where the spleen is, I will tell you. If you tell me where the liver is, I will tell you. You don't need review for this, because these are things that make you a qualified nurse. These are things that make you what? A safe nurse. Right. So
Yeah.
let's fix the way we pay attention to nursing. Let's fix the way we love nursing, and let's fix the way we love caring, and let's fix the way we want to make sure that the client is safe. That way, everything will be a good process for us. Why? We are going to love what? Studying. The process of studying involves one goal in life. I've seen a lot of students that will come to me and say, I am really struggling. Favour, I want you to coach me to pass the NCLEX exam. I'm trying to give my daughter a better life. Now, look at the linkage, right? These students want to give what? A daughter a better life. So the aspect of giving a daughter a better life is what? To pass the NCLEX. So
Mm,
what is driving her to pass the NCLEX is because of the daughter. Now, same thing with passing the NCLEX exam. Now, if something is not driving you to read, then you will not be able to study. Now, my biggest driver is I want to be able to care for my clients in a way that I am a safe nurse. So all I
mm,
need to do is to understand the aspect of care a client need. And that is the main reason why NCLEX gave you the 8 client needs, so that before you attempt the NCLEX exam, you can easily know the aspect of care. So
mm.
NCLEX, to me, I feel NCLEX have done everything possible for every student to pass the exam. Now, the student now need to now study this area to now show the NCLEX that they are a safe nurse. NCLEX is not difficult. NCLEX just want to see that you are a safe nurse. NCLEX is not trying to add more workloads to what you've done in nursing school. You've done everything possible in nursing school. You've graduated. NCLEX is glad about that. But NCLEX know that some students bypass their way in nursing. So NCLEX is trying to filter out the unqualified nurse to the ones that will be truly qualified, show that what they are a safe nurse. That's what NCLEX is just trying to do. It's not trying to add more information to you. Instead, it even reduce information. Think about it. In nursing school, you learn thousands of information, but NCLEX is just opening you to what 146 information as RN, and for PN 150 information. You are taking the RN exam, so you need to focus on this 146 information. Unlike in nursing school, you learn thousands of information. So now the moment you can focus on this and the aspect of what are you doing, is it internal care, is it external care, you are able to think. You are able to think. Nothing is not difficult. Nothing is not difficult. I understand nursing school, we try to figure out everything and then the structure got damaged. But yes, I'm ready to fix it back for you. But you need to understand the basic aspect of nursing, which is the client. Because people study like they are taking care of different kind of body system. We only have 10 body system. Some people think like they don't even know what they are taking care of. They think it's about the condition. Okay, let's think about this way. If a patient is having asthma, what body system is affected? The respiratory. If a patient is having pneumonia, what body system is affected? The respiratory. Is it asthma that caused the symptom, or the body system that caused the symptom? Like now, if you are feeling pain, you are going to scream or you are going to cry, right? The pain, you are feeling the pain, the way you react is to either scream or cry. Same with the respiratory system. When asthma coming into the body system have a way of reacting to the asthma. Now, how will the body system react to asthma? By what? Wheezing. So that way we can easily say, oh, this it's just like right now, people can feel two type of pain, right? Physical pain, psychological pain. Now, if you are feeling pain and you are holding on to one part of your body, I can easily say, oh, are you feeling pain in that area? Right? But if you are feeling pain and you are just free, but you are just crying, I might ask you, what's wrong with you? What's going on? Maybe related to relationship breakup or something like that. That's another kind of pain. Now, same with the body system. If we have different symptoms related to respiratory. Now, if a patient is having, if a patient is wheezing, then what I'm thinking about is, oh, do you have asthma or COPD? That's what I'll be thinking about. Now, if a patient is having crackles, what am I thinking about? I will say, do you have pneumonia, influenza? Because these are things that can cause all these kind of what? Symptom, right? Now, let me now tell you how the NCLEX wants you to think. On the NCLEX test plan, NCLEX wants you to know the pathophysiology of all these disease conditions. Because
So let
NCLEX believe.
me ask you. So the NCLEX, do they, like, I'm looking at my test plan, do
Okay.
they really want you to have above passing in all of these categories?
No, 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 no. At least 5 areas, not all.
Oh, I see.
They don't want you to
Because,
have above passing standard every area.
okay. So you have to have above passing in 5 major categories.
Yes, yes, yes. If I do the calculation for you, 5 key area I focus on for students give you 73% of the exam. So once you can focus on this area, yeah.
Okay. Now it's better.
Yeah.
Yes,
Yes, so
because
5 key
I'm
area
like,
you pass.
okay,
Yeah.
sorry for
No,
cutting
no
you off.
problem. No problem. Now let me re-explain what I'm saying. We have the respiratory system, right? And then we have the condition. Now, the respiratory system, NCLEX wants you to know how it works and the sign and symptom it display, right? Now, for the condition, example, asthma, NCLEX just wants you to know the pathophysiology of every disease condition. Now, the moment you already know how the body system work and the symptom it display, you can easily link a particular symptom to a specific pathophysiology. Like now, asthma, there's tightening of the airway. So due to that, patients will have what? Wheezing. Now, if NCLEX is not telling you the patient have asthma and the NCLEX is telling you about wheezing, one of your suspects will be, oh, I know about asthma. Asthma part of physiology is related to wheezing. So might be the patient is having asthma. Now, that is how the critical thinking come in place. It's not magic. It's what you know that bring out the critical thinking. Now, COPD as well to have similar thing because COPD is a combination of chronic emphysema and chronic bronchitis, right? Bronchitis, I mean. Now, so bronchitis can also cause wheezing. So I can easily say, oh, this patient might be having asthma, this patient might be having COPD. Only from what? The wheezing. And this knowledge comes from what? Understanding the body system, how it works, and related sign and symptom. That way, even if I have 1,000 disease condition, trust me, we don't have 1,000 sign and symptom. 1,000 disease condition don't equal 1,000 sign and symptom. They might just only this body system might just have 10 sign and symptom, and this sign and symptom is related to 1,000 disease condition. So that's why I tell students when you are focusing on 200 plus disease condition, I see some guru selling disease condition, 200 disease condition PDF and all that kind of stuff. It makes no sense to me. Because this is just what you want to know that will create all the knowledge you need for 1,000 disease condition or 200 disease condition. If you are telling students to study 200 disease condition, it only means that you are telling them not to know the foundational knowledge of care. That is just what you are telling the students not to. You are trying to make them bypass the foundational knowledge of care, which will not help them on the NCLEX exam. Because NCLEX exam currently now involve what? Critical thinking. And before you can critically think, you need to be able to pick out a specific knowledge. A lot of students don't know how to answer reduction of risk question. I saw your reduction of risk area you had near the passing standard. Reduction of risk is a particular area you need to be above the passing standard. Do you know what reduction of risk means? You are not trying to treat the patient. You're only just trying to avoid a certain risk potential. It's just like a patient is at risk for low oxygen. So what do you do for a patient that is at risk for low oxygen before the patient have the low oxygen? What do you do for a patient that is having that is at risk for infection before they have the infection? That is what reduction of risk is testing you. So if a student is below the passing standard in reduction of risk, it speaks a lot of how they understand nursing. Management of care, I get it because prioritization, a lot of students don't know how to prioritize. The ethical aspect of nursing, most students don't pay attention to that because I've gone through various question bank program. They don't really pay attention to the ethical aspect of nursing. It's more of disease, condition. So now a lot of students don't even know the ethical aspect is there, and you might get a lot of question on the ethical aspect, and then your management of care, you have below the passing standard or near. And remember, the exam is distributed into percentage. Management of care is the highest on the exam, which is 18%. So if anyone fail 18% of that exam, then there's a big problem. What is left to answer again? Right. So not only you need structure, you need to as well understand what you are doing, because you might have a clear structure. Like now, people will just say, I want to know what I will be reading each day. They will get a program that have a study schedule. Yes, that is a good start. But do you understand what you are doing? No, a lot of students don't understand. A lot of students don't understand. So in order to pass the exam, right? So far, so good. I've been doing this with 700 students. You need to know the foundation of nursing. So I drag you back to it. And what are the foundation of nursing? You need to know your vital sign. You need to know the 10 body system. You need to know about structures, the body structure. That's the main reason why the body structure that a lot of students don't know. That's the reason why they struggle with case study on the NCLEX exam. Because they want to know the disease condition before the exam. They will be learning thousands of case study. They'll say, oh, I still need more case study questions so that I can cover everything NCLEX might likely test me. You don't need what the disease condition look like. You just need to understand this, and understand this. You will figure out the disease condition. NCLEX don't even want you to figure out the disease condition because you are not the doctor, right? Your case study involved 6 parts. You're recognizing clue, analyzing the clue, prioritizing hypothesis, generating solution, taking action, and evaluating. Now, when you are trying to generate solution, NCLEX will give you the diagnosis. So you don't need the diagnosis before the exam. You don't need to start memorizing different diagnoses. No, all you just need is to understand the vital sign, what can make it abnormal. You need to understand each body system, which this is 90% of what will make you to pass case study. And then this part, you need to understand the body system. I'm exaggerating. This should not be 90%, but let me say together, this should be 90%. And then this will be
Mhm.
your 10%. Right. So because I don't know how many percent I should give this is very important, so as this is very important. But body system like 10%. But body structure. Right. But the body system, very important because now body structure in the sense that I saw a particular question on the exam that said someone got injured in a particular area. So NCLEX is trying to test your knowledge on what? The body structure. Now, when you spot the area that the patient is injured, you can start knowing things that are in that area, organs that are in that area that can be affected. Now, you might not really identify what organ, but the presentation of that patient will start telling you about the organ. So, how do you get to understand the presentation when you understand the body system? You can never go wrong with the presentation. If I see if I see a girl right now crying continuously, right? Maybe she was previously in a maybe she was in a relationship. I might easily start suspecting maybe she got heartbroken. Maybe,
Mhm.
like I will start thinking like that because it's the presentation, right, that is making me think that way. So
Mhm.
now, because I know something about that particular lady, she's in a relationship, maybe she have a particular relationship, there's a lot going on, and now she's crying. I might start thinking, okay, maybe the relationship is the one causing the problem. Same way, if I go on the NCLEX exam initially by knowing the vital sign, knowing the body system and knowing the structure. This way, there's no how the NCLEX can play on my intelligence or my knowledge because I have everything covered already. Now, NCLEX said the patient got injured in a particular area. They are not telling us what the problem is, but they told us the area. So I can spot the area and start thinking about the structure that is there. Then I'm thinking, okay, it might be the spleen, it might be the liver, it might be the lungs that might be affected in that area. So I'm thinking about these things, but I don't know which one, whether it's the lungs, whether it's the liver, whether it's the spleen. I don't really know, but I have an idea because of the area that NCLEX is mentioning, and then the body structure that we have there, the body organs. Now, the presentation will not make me know if it's the lung that is affected, if it's the liver that is affected, if it's the spleen. Now, guess what? The NCLEX now said that the patient have low hemoglobin. The
Mhm.
NCLEX said the patient have low hemoglobin. The NCLEX said they have 6, their level. Then I'm not saying, obviously, hemoglobin cannot be a lungs issue. Hemoglobin cannot be a liver problem. Obviously, hemoglobin is a what? A spleen problem. Am I making sense? Am I making sense?
Yes.
All right. Now, since I know hemoglobin is what the NCLEX is talking about, I know it's not a lung problem because if it's a lung problem, I expect the question to be saying something like the patient is having respiratory issue, oxygen problem, difficulty breathing, all that kind of stuff. If it's a liver issue, I expect the NCLEX to be saying maybe they have pain in that area, or maybe there's a lab result that is talking about the AST is affected, the ALT, it's high or something like that. Now, but NCLEX is not saying that. Instead, the presentation is that the patient have low hemoglobin, and also the vital sign is saying the blood pressure is 80/50. Then 100%
Oh.
I can tell what is affected is what? The spleen. So now I know how to react because each of these body system you need to know specific intervention to each. When the patient is having low oxygen, you need to know the intervention. When the patient is bleeding, you need to know the intervention. When the patient is having neurological issues, you need to know the intervention. When the patient is having GI issues, you need to know the intervention. That is how we think as a nurse. We are ready for any question. The problem is we did not fix the foundation. That's why it become a problem. So at this point,
Mm.
I want to ask you one question. Are you ready to pass the NCLEX exam?
Yes, of course.
All right,
Why?
great. So if you're ready to pass the NCLEX exam, so let's do this together, right? So I run a 8 weeks coaching program, right? This is how I break it, right? 4 weeks, 2 weeks, and 2 weeks. So the first 2 weeks is content, right? I have all the whole content that you need to know, right? I'm doing this together with you, so it's taking the load off you, right? 2 weeks is question, and then the last week is what? Strategy, right? This way, once you go through this process, you end up passing the NCLEX exam. So far, so good. My students go through this process and they all pass the NCLEX exam. In as much you do the work and you
Mm.
understand and you are not rushing. The biggest thing is that you are not rushing because uh you might be a slow learner, you might be somebody that catch up things fast. But yeah,
I am
if you can
not,
easily understand, you are saying something.
no, I say I am a slow learner and I'm not rushing.
All right, no problem. So because most people rush because of they need money, most people rush
Oh,
because life is going in a certain way and they want to just get the job so fast. You are not
yeah,
going to help yourself by doing that. The only thing that will make you to take the NCLEX exam is if you can go through the 146 NCLEX content and then you are 100% sure that you can answer a question in each of those content. If not, it makes no sense to me rushing to take the NCLEX exam, right?
no,
Because it will be more of a big problem to you. You have to pay another $200. You have to wait another 45 days, right? And you have to
yeah,
study for maybe probably another 60 days while people are already working and they're already making a living out of their dream job, right? So everything will come in place, but the key thing right here is to follow a process, understand, be patient with yourself, and then you will definitely get the desired result. Right. NCLEX is not difficult and it's not going to be difficult. 88% of students pass the NCLEX exam as at March. Right. Leaving only 12% of students failing the exam. Right. And people that are repeating the exam, the pass rate is 35 to 37%. Imagine only 35 to 37% are repeating the exam.
mm-hmm.
So, meaning if you have 100 students who take the NCLEX exam, only 35 will pass and the remaining ones are going to fail. For people that are repeating the exam, this is their pass rate. For people that are taking the exam for the first time, this is their pass rate. So, now, situation at which you are repeating the exam, you are trying to be among what? The 35% of students that are passing the exam. Which so far so good. I've done it with many students, yeah, and I'm proud of it. Why? Because to be among the 35% whereby the pass rate is like the odd of student passing when they repeat the exam is that 35% of every student that take the NCLEX exam only pass. Now, being having a student that is part of that 35% means that I am pretty much doing
The right thing.
something, yeah, something awesome, right? So, yeah, let me give you the transformation you need, which is becoming a registered nurse. And I believe at the end of this 8-week program, you'll be successful and you'll be able to pass the NCLEX
So,
exam. So the coaching program, the investment is just $497 for the coaching program. Right. Any question?
no,
All right.
yeah. So for this, do you have like a payment installment program or something like that?
Yeah, yeah, a lot of students pay this in full and a lot of students pay using payment plan. So the payment plan you pay 250 down payment
Yeah.
now and then you can pay the other one. You just tell me when you are going to pay the other one. Right. So which one are you doing today? The payment plan or you are paying full?